welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and here is what I bring to you all from the world of medicine. Effects of pollution on health and factors adding to increased death rate. Exposure to the air pollution known as fine particulate matter PM 2.5 is associated with an increased risk of having a cluster of multiple chronic diseases, according to a new study published this week in the open access journal PLOS Global Public Health. In the new study, the researchers used data on 19,098 respondents of the China Health and Retirement Longitudinal Study surveys from 2011 to 2015, as well as historical satellite data on PM 2.5 exposure over 15 years. Participants were people aged 45 to 85 from 125 cities across China. The team modeled the associations between self-reported chronic disease diagnosis and PM 2.5 exposure. The data revealed 4 distinct groups of multimorbidity, with patients sorting into respiratory, musculoskeletal, cardiometabolic, or healthy clusters. The analysis showed that a 1 microgram per cubic meter increase in cumulative exposure to PM 2.5 over 15 years was associated with a 2.4% increased chance of belonging to the respiratory cluster, a 1.5% increased chance of belonging to the musculoskeletal cluster, and a 3.3% increased chance of belonging to the cardiometabolic cluster. However, the models also showed a U-shaped association with both lower and higher PM 2.5 exposure associated with increased multimorbidity. The increased multimorbidity at the low end of the spectrum may be due to differences in rural-urban living and economic development, the authors hypothesized. The authors concluded that current PM 2.5 levels are harmful to human health among the majority of Chinese adults, and that for most low and middle income countries, efforts to reduce PM 2.5 would likely be associated with a substantial reduction in the burden of multiple diseases. Changes happening in brain in women after menopause. Women who have gone through menopause may have more of a brain biomarker called white matter hyperintensities than premenopausal women or men of the same age, according to a new study published in the June 29, 2022 online issue of Neurology, the Medical Journal of the American Academy of Neurology. The study involved 3,410 people with an average age of 54. Of those, 58% were women, and of the women, 59% were postmenopausal. Also, 35% of all participants had high blood pressure, and of those, half had uncontrolled high blood pressure. All participants had MRI brain scans. Researchers looked at the scans and calculated the amount of white matter hyperintensities for each participant. Average total volume for these brain biomarkers was 0.5 milliliters. Average total brain volume was 1180 ml for men and 1053 ml for women. Average total white matter volume, the area of the brain where white matter hyperintensities can be found, was 490 ml for men and 430 ml for women. Researchers found that postmenopausal women had more of these brain biomarkers when compared to men of similar age. In people 45 and older, postmenopausal women had an average total white matter hyperintensities volume of 0.94 ml compared to the 0.72 ml for men. Researchers also found that postmenopausal women had more white matter hyperintensities than premenopausal women of similar age. In a group of participants aged 45 to 59, postmenopausal women had an average total volume of white matter hyperintensities of 0.51 ml compared to 0.33 ml for premenopausal women. There was no difference between postmenopausal and premenopausal women using hormone therapy. Brettler, the study's author, said that this finding suggests that hormone therapy after menopause may not have a protective effect on the brain. It has been known that high blood pressure, which affects the small blood vessels in the brain, can lead to an increase in white matter hyperintensities. The results of their study demonstrated the necessity to account for different health trajectories for men and women and menopausal status. Researchers underscored the importance of sex-specific medicine. The long-term effects of fertility treatments on children born with their help. Children conceived through medically assisted reproduction fare better at school but are slightly more likely to have mental health problems by their late teens, finds a new study published in the European Journal of Population. The observational study explores the link between medically assisted reproduction, including techniques like IVF treatment, artificial insemination, and ovulation induction, and young people's educational outcomes and mental health. The researchers used administrative records on 280,682 Finnish children born between 1995 and 2000 and compared a range of educational and mental health outcomes among adolescents aged between 16 and 18 who were conceived naturally and through medically assisted reproduction. The researchers found that adolescents conceived by medically assisted reproduction performed better in school, were less likely to drop out, and were at a lower risk of not being in education or employment or leaving home early compared to naturally conceived adolescents. These differences mostly disappeared when family circumstances were accounted for, suggesting that socio-economic background is an important factor in explaining this advantage. The researchers also found that adolescents conceived via medically assisted reproduction were not more likely to experience mental health problems. However, after accounting for family circumstances, the study revealed that they were at an increased risk of developing a mental disorder, particularly anxiety or depression, with around 10% of medically assisted reproduction conceived adolescents compared to 9% of naturally conceived adolescents receiving a mental health diagnosis between ages 16 to 18. Researchers conclude that, small as a percentage, this difference in risk is comparable to the difference between children of secondary and tertiary educated parents. Although modest, the findings based on several indicators of mental health were consistent. Peripheral arterial disease, its complications in venous thromboembolism, and its treatment by rivaroxaban. A new cohort study found that 6,564 patients undergoing lower extremity revascularization for peripheral arterial disease, the 3-year rate of venous thromboembolism or VTE in patients receiving placebo was 1.66%, and low-dose rivaroxaban plus aspirin was associated with reduced risk for venous thromboembolism. Previous studies have observed an association between the burden of atherosclerotic vascular disease and the risk of venous thromboembolism. The association is not known in peripheral arterial disease after lower extremity revascularization. The study was a global multi-center cohort study that used data from the vascular outcomes study of ASA along with rivaroxaban in endovascular or surgical limb revascularization for Voyager PAD randomized clinical trial, which enrolled patients from 2015 to 2018 with median follow-up of 28 months. Participants included patients with peripheral arterial disease undergoing lower extremity revascularization. Patients with an indication for therapeutic anticoagulation were excluded. Data were analyzed from September 2020 to September 2021. Randomization to rivaroxaban 2.5 mg twice daily or placebo on a background of aspirin 100 mg daily, short-term clopidogrel was used at the discretion of the treating physician. Among 6,564 patients, 66 patients had at least one venous thromboembolism. The 3-year rate of venous thromboembolism in patients receiving placebo was 1.7%, hypertension was 2.11, prior to amputation 2.07, and older age 1.81 were associated with increased risk of venous thromboembolism. Venous thromboembolism was associated with risk of subsequent mortality of 7.22. Compared with aspirin alone, rivaroxaban plus aspirin was associated with lower venous thromboembolism risk of 0.61, with benefit apparent early and sustained over time. This association was not modified by use of clopidogrel at randomization without clopidogrel 0.55 with clopidogrel 0.69. Researchers conclude this study there was continuous risk for venous thromboembolism after lower extremity revascularization in patients' peripheral arterial disease. Low-dose rivaroxaban plus aspirin was associated with lower venous thromboembolism risk compared with aspirin alone, with benefits apparent early and continued over time. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.